Welcome to Straight Back Talk, a podcast where I clear up confusion, bust myths, and give you the straight truth about your neck pain, back pain, disc injuries, and all sorts of conditions to help you non-surgically recover and live a great life. I also help you, if you do need surgery, how to do the right surgeries without serious injury. I'm Dr. Jeffrey Garofalo, a practicing chiropractor of 23 years with advanced certifications in spinal biomechanical engineering, MRI interpretation, as well as neuroradiology. I have a mini fellowship in neuroradiology. I've been published in the National Institute of Health. I am also a candidate for a fellowship in primary spine care. I've also written this book right here, Never Look Back, a simple guide to the causes and care for back pain. And the reason I wrote it is to do just this, help you look forward to living a life pain-free with your neck and back. Today's episode all about bone conditions associated with spinal disc injuries and their connection. And today I'm going to talk about 3 injuries. So we're going to talk about spinal disc injuries, but we're going to talk how they relate to 3 different types of bone injuries. And so this is super important. Then we'll get into a case history, which was pretty crazy. And then we're going to talk about exactly what you can do surgically and non-surgically to help some of these things out. So let's jump in right away. So there are 3 types of bone injuries associated with spinal disc injuries that I want to talk about today, and sometimes they're often missed. The reason they're missed is because the clinician, the chiropractor, the medical doctor, your general doctor, even some orthopedics, their exam might not be thorough. So in order to determine if bone is involved with your disc injury, you need to make sure you've got several things. Number 1, a great set of spinal x-rays from top of your neck all the way to your low back, regardless of where your pain or you think your disc injury is. Why? Because proper alignment reduces disc injury risk. Improper alignment from spinal biomechanical engineering will create more disc injuries. So we want to make sure we have a full set of spinal x-rays from top of your neck all the way to your lower back to make sure pressure is where it belongs, as well as to see where misalignment is and could lead to one or more of these types of injuries. Second thing we want is we want a great MRI. An MRI is, yes, we call the T1, will show if there's any bone disease, but they're using what's called the T1 image and the T2 image will absolutely help us determine one of these injuries and how to determine which level they're at, 1, 2, or 3. It'll help us look at the ligaments around the joints called the facet joints to know if there's facet injury we're going to talk about here, as well as what's going on with the ligaments. It'll also help us understand if one of these bone injuries we'll talk about was due to a trauma or if it was due over time. So we definitely want a strong MRI. In another episode, we're going to talk about what makes a strong MRI, and what doesn't, because not all MRIs are created equal. Just because it's cheap or expensive means nothing. Strong magnet, slice thickness matters. Your doctors, your chiropractor, your general practitioner, your orthopedic should know. Magnet and slice thickness matter. And lastly, you should have a fantastic hands-on examination where the doctor is asking you specific questions that line up with levels you're in pain, and then run specific hands-on testing to determine if we think bone is involved with one of these types of injuries. So X-ray, full spine, your practitioner should be taking full spine X-rays to look at alignment. Misalignment creates one major issue here, plus disc injury. MRI shows, we call the facet joints, which we'll talk about as a type of injury. It'll show if there's level 1, 2, or 3 of the changes we'll talk about, and it'll show if one of these processes is either trauma or degenerative, which helps. And then we want to make sure your practitioner use their hands and their mouth to say, hey, where exactly, listening, asking you, listening with their ear, mouth talking, listening, and then hands-on, where exactly are the problems and do they line up with one type of these injuries? So without further ado, let's start talking about the types of bone injuries associated with disc injuries. And the first type of injury we're going to look at is called a Facet syndrome. What the heck is a Facet syndrome? Well, it's one of the pain generators when you've got a disc injury. These bones right here, this bone and this bone, come together via this joint right here. That joint right there is called a facet joint. It's where the two bones meet and they glide past each other, and the facets are built to hold this bone in line with this bone, and as long as your disc right there is nice and thick, it separates these joints with just enough separation. What can happen in a facet syndrome is with a misaligned spine through X-ray from top to bottom, we can find out what the spine is misaligned. And when it's misaligned, you're putting pressure on the disc where it doesn't belong. Put enough pressure on this disc, it's a water balloon, you start to leak water. When you leak enough water, you start thinning the disc and squeezing it together. Now these joints right here, they start grinding past each other at a higher rate when you lose the space of the disc. When you lose the space, they think sandpaper rubbing past each other. And as they rub past each other, they start creating irritation in the little nerve endings around themselves. And then what happens is, as they slide past each other, when you twist and turn or maybe you jerked, think of these as two cymbals on a drum. They slam into each other. And when they slam into each other, they create an inflammatory process. You start laying down more bone. You start irritating the nerves within where these two bones meet, and you start creating what's called a Facet syndrome. Facet syndrome occurs when the disc loses its space, the spine misaligns, and now you start wearing these joints into each other. They start banging into each other. They irritate the nerves, and they create an inflammatory response called a Facet syndrome. Typically, when you stand and lean backwards, you're going to get some pain with that. That's why I said your doctor, one of the tests they'll do in order to determine a Facet syndrome is they will lean you backwards and twist you. And if there is pinpoint pain right along the spine, right in what we call the column of the spine where the facets would be, we know that there is a Facet syndrome. We know that when we look at X-ray, if there's a misalignment, we know there's a possible Facet syndrome when there's disc loss. And then when we look at the X-ray and we see thin space, and we look at an MRI now, we can actually look at these joints called facets. We can look at the ligament on the inside thickens when these start to rub past each other. It thickens, and then you start forming fluid inside there that becomes too much. And based on the leaning back and twisting and that pinpoint pain, based on the thinning of the disc, based on the misalignment on the X-ray and the MRI, we come up with a diagnosis of Facet syndrome. So Facet syndrome is a bone challenge affecting a nerve because we've gone out of alignment and the disc is thinning, and you're rubbing these joints together and they're clanging like cymbals. As they clang, they irritate the nerve, they cause an inflammatory process. And so that is how we would use the testing, use the history, use an examination to determine, do you have a Facet syndrome? And yes, Facet syndromes can be helped non-surgically. We do it all the time in the practice. So that is the first type of bone injury we want to talk about, is a Facet syndrome as it relates to a disc, relates to examination, as well as testing in order to get a proper diagnosis. Now, what's treatment for that? In the medical world, anti-inflammatory, something called a rhizotomy. They're going to go in there and they're going to take a nerve-killing little probe and they're going to heat it and kill the nerve so the pain goes away. You might do an injection there. This is all medical-based, right? So non-surgical is going all the way back to the alignment, stabilizing the alignment. In our office, we stabilize the alignment. We stabilize the disc decay and degeneration, and we get the disc pump to start pumping again so that we can actually start moving it correctly. And then we make proper alignment to make sure that this holds alignment. And then we train we train the core muscles around this in the low back, and we train the neck muscles how to hold this in better alignment. So it can be done non-surgically. Sometimes that joint is so irritated and everything we do non-surgically does not work. So the patient will go get an anti-inflammatory, have a rhizotomy. Pain goes away, we wind up stabilizing the rest of it, and the pain never comes back after we stabilize it. Second type of injury as it relates to a disc, we call a spondylolisthesis. Now this hit the media not long ago. United Healthcare CEO was gunned down apparently by this gentleman who had spondylolisthesis, back pain, was on opioids, and all this information, but neither here nor there. Spondylolisthesis. Spondylolisthesis means that the bone on top has slid forward on the bone below. And there's two reasons for spondylolisthesis. So as we doctors use our ears and our mouth to talk to you and we listen with our ears, we're looking for trauma. I was in a car accident, I was some type of rear end accident. A lot of times it's a slip and fall. I fell on my rear end is a big one. At that point, spondylolisthesis comes in two types. The first type is called a lytic, or a fracture, where you have that trauma and you fracture this part of the spine right here, called the pars interarticularis. And when you fracture the pars interarticularis, this part of the spine stays here, and then it separates the front part of the spine from the back, and then the front slides forward, leaving the back part back here. We call that a lytic. We listen for it in our history. This is also where chiropractors who are adjusting without x-rays are running a major risk. You never want to do that, because if you have a lytic spondylolisthesis and it has slid forward and you make certain types of adjustments, you can make it worse. You could damage that patient and cause what we call caudate equina syndrome. You can paralyze the patient if you're not taking x-rays. So you listen. If there was trauma, sit down, car accident, buggy accident, you're taking x-rays from the side, called lateral x-rays from the front, and then if we're suspect of it, we do what's called an oblique x-ray. We turn you 45 degrees and we get an image of that pars interarticularis. And if we see a separation there, now we do a whole nother set of x-rays called flexion extension, where you touch your toes and come back, and we're looking for slippage forward and backwards to determine if it's stable. If you go forward and backwards and there's no slippage, it's a stable spondy. If it slips, it's an unstable spondy. So in our practice, we've seen grade 1, which is 25% slippage. Grade 2, the back of this goes halfway, 50% slippage on the bottom. Grade 3, the back of this is 75% slip forward. Grade 4, the back of this sits here, 100% slip forward. So in our office, when we take our x-rays and we see this, yes, we also get an MRI. That's to determine how it relates to the disc. But we have helped grade 1, grade 2, and grade 3 that were stable. If it is unstable, or grade 4, it needs to go to the orthopedic to determine if a fusion is necessary. How does it relate to the disc? Well, when it slides forward, pressure gets put on the front part of the disc where it doesn't belong, and you start pushing this disc backwards. And you form what's called a pseudo or false herniation, where this part of the disc pushes out because there's pressure where it doesn't belong, because this has slid forward because of a fracture here. That's the first type. Now, the second type of spondylolisthesis is called a degenerative. Degenerative means this. It means from top of the neck to the low back, there's misalignment in the spine. It means that misalignment has taken the vertebrae out of alignment and affected what's called the facet joints we just talked about. The facet joints have become so worn down, and this becomes so thin, that actually the bone starts to remodel. And these parts, called the pedicles, this part right here, which connects the back to the front here, not the pars interarticularis, but the pedicles right here, actually become elongated, which allow the front part to slide forward on the bottom. Again, grade 1, grade 2, grade 3, and grade 4. As we talk about our case history, I'm going to talk about an insane thing that we saw. Couldn't believe it. insane, and is actually on one of my videos on my channel. You have to check that out. We'll put the link to it down below. If you want to see what I'm about to talk about in our case history, the link will be down below. You click on that. It is unbelievable what we saw, what came walking in that shouldn't be, but I'll get to that later. So spondylolisthesis will affect a disc. How? Well, as that front part called the vertebral body slides forward on the bottom bone, what happens is you start squeezing that disc like I talked about. We squeeze the disc, it's got added pressure that wasn't there before, and you form a pseudo herniation or a false herniation. So history, series of x-rays, MRI to determine if there's a pseudo herniation, if it's affecting the nerves. Now, again, if your chiropractor is doing none of that, and they are adjusting you, or your physical therapist is performing manipulation, you run the risk of taking this and pushing it all the way forward, and then that disc could come off the bone. That's going to be a major issue, and then this disc will push all the way into the nerve endings that come down, called a Modic Changes syndrome, can create a paralysis of your legs, as well as affect your bladder and your colon, to the point of a couple things. Number one, I just wet my pants and didn't realize it. Number two, I'm trying to urinate and nothing's coming out. The balloon is growing and it's not emptying. Same thing with the bowel. I just defecated, didn't realize it, or I'm trying to go and nothing's coming out. That's a problem. So that could be what we call a Modic Changes. So if your chiropractor or your physical therapist are manipulating or adjusting you without x-rays, and there's a possibility of a spondylolisthesis, there could be major damage there. So there's a specific type of adjustment we do in our office after we diagnose it that works very, very, very well. And we'll do a video on that at some other time. But that's the second type of bone issue that can be correlated with disc. And the last one is one of my favorites. The last one, bone issue, as it affects disc, is called Modic Changes. There's a neuroradiologist by the name of Dr. Michael Modic, and if you see this, I'd love to connect with you. Your work is just fantastic. Michael Modic. Modic Changes, Modic 1, Modic 2, and Modic 3. He's a neuroradiologist. He is, I believe, at Vanderbilt at this point, and he was studying MRIs, and he discovered that there were several bone changes in what we call the T1 and the T2 image. So let's talk about this. The bone here is not solid. This bone is not solid. It is hollow like a honeycomb. And that honeycomb has blood vessels that go in and out of it. And it is a hydrostatic system where this disc has no blood supply. So what happens is we talk about, you've heard me talk about this disc pump. Well, this bone and this bone, when you bend and twist and turn, has to create a pumping motion. There has to be a pumping motion here. That pumping motion takes nutrients through the blood vessels in the honeycomb here and puts it in the disc. And then as you release, the waste goes into the veins and then out. So nutrients through the arteries in the bone go into the disc, waste comes out through the veins. There's a hydrostatic, bendable, pushable system like a pump, like a heartbeat. Well, what Dr. Modic studied and came out with was Modic Changes. Modic 1, Modic 2, and Modic 3. And there's very specific changes on MRI. That's why we read our own MRIs, right? So in office, I've got a mini fellowship in neuroradiology. I've been reading MRIs, thousands of them since 2013. As a matter of fact, I started my analysis, my studies with Dr. Robert Peister, who's a neuroradiologist out of Harvard, who actually helped the gentleman develop protocols for spine when they developed the MRI at State University of New York on Long Island. So that's where they developed MRI, and he was influential in helping the two gentlemen who created MRI actually build protocols for spine, and I started with him in 2013. So we read our own MRIs, and we're looking for Modic Changes because that tells us a lot about the disc. So what about it? Well, Modic 1, and I'm going to say this, on T1 is dark, on T2 is light. That tells us that the hollow honeycomb, it stopped pumping, and as a result of it stopped pumping, you're now forming inflammation right here at what we call the end plate. So an inflammatory process has now ensued because there's no more pump. And as it stops pumping, Modic 2, which is bright on T2 and bright on T1, tells me that this inflammatory process has now gone into fatty changes. Fat, like on your thighs and your arms and your legs, is now infiltrating the honeycomb here. And lastly, Modic 3 is dark on T1 and dark on T2, which tells me there's sclerotic or dying bone. All which indicates the pump is no longer pumping the way it should, which tells me the disc is no longer getting the nutrients in, the waste out. It's like holding your breath. It forms what's called phospholipase A2. And as a result of phospholipase A2, the disc starts to weaken. It changes its shape, called morphological changes. Now we start getting the bulge, the herniation, the decay, the morphological changes, or the disc injury. And so Dr. Michael Modic, and I've been fascinated with Modic Changes as I read these MRIs, developed a category of 1, 2, and 3 where it lets us know the disc pump isn't working and how it's affecting the actual disc itself. And because the bone itself is dying, the bone can create pain, another source of pain. Facet Syndrome, Spondylolisthesis, and now Modic Changes can be a source of pain associated with disc injuries. So if your practitioner isn't excellent, isn't doing the right history, the right examination, looking at MRIs the right way with x-rays, you're missing a whole bunch of stuff, and you might be heading towards useless care, wasting time, wasting money without a diagnosis, and you might even be going for surgery and not necessarily need it. Because yes, there are fixes to getting the pump pumping, stabilizing a spondylolisthesis without surgery, and helping a Facet Syndrome stabilize without surgery. What are some of the ways? Well, I'm going to share with you some really big ways before we finish up with our case history. Core stabilization. I'm going to give you just a handful, let's give you 2 or 3 simple things you can do in order to help Facet Syndrome, in order to help spondylolisthesis, both lytic and degenerative, and in order to help the pump, the Modic Changes. Super simple, core stabilization. Let's give you a handful. Lunges. Lunges will work not only on legs and rear end, which is going to help stabilize the pelvis and core, but it's also going to work on the core muscles. So lunges, forward stepping lunges, backward stepping lunges. First try no weight at all, then you try a little bit of weight. Just simple lunges. Second, box step-ups. Side box step-ups, forward box step-ups. Box step-ups will help build legs and build core. In order to stabilize the low back, spondylolisthesis, Facet Syndrome, even Modic Changes, build your core muscles. Leg muscles, rear end muscles, abdominals, rectus abdominis, obliques, these are core muscles, and you could build them very simply through lunges. Forward, backward lunges, box step-ups, sideways and forward. And the last one we'll give you, let's just say, is body weight squats with your back straight. These are 3 simple things you can do. Again, I'm not telling you to do it. I'm not your doctor. Check with your doctor first. I'm not giving any advice. Once you check with your doctor, as long as they approve of it, those are 3 simple things that we do with our patients. Lunges, backward lunges, box step-ups, sideways forward, and air squats. Simple things you can do. Let's finish today with this case history. Unbelievable. We had a patient come to us from somewhere between 6 and 8 hours away for a second opinion. Their first opinion, get this, was from a surgeon. See, we do things at such a high level that we have patients come from all over the country, and we were the second opinion for a surgeon. So this young 17-year-old kid comes walking in from somewhere between 6 and 8 hours away in PA, Pennsylvania. Did the history, took the exam, took the x-rays. As soon as we took the x-rays, we said, it is time for you to go back to your surgeon and have surgery right now. As a matter of fact, down, I will put the link to the video of what you can see in the MRI. There are 4 types of spondylolisthesis, grade 1, 2, 3, and 4. I have to name a brand new one after looking at this, and you will see what I mean down below when we put the link. Grade 5 spondylolisthesis. The lumbar number 5 bone, was sitting in front of the tailbone called the sacrum. The bone had completely come forward, fallen off, and sitting right in front of what we call the sacrum. I'd never seen that before. We've seen lots of things, grade 5, I had to name it a grade 5 spondylolisthesis, came walking into our office. We have no idea how this kid came walking in. Immediately we said, we're not touching you. Go back to your surgeon and have the surgery. It is a safe surgery, meaning I can't guarantee you're going to come out alive or anything like that, but that is something we would say 100% of the time, go for surgery. That is your only option. We didn't even know how he was walking in. The worst part was we said, hey, make sure you don't go see a chiropractor and get adjusted, and the parents turn red, which means, yes, this kid had been adjusted. Now, whoever adjusted this kid without x-rays, because they didn't even know this was going on, the surgeon had to tell him, literally could have paralyzed this kid from the waist down, could have shut off his bladder, his colon. So unbelievable. The link is down below. Click on the link back to the video and you'll see what I'm talking about, a grade 5 spondylolisthesis. Gang, I appreciate you being here on this episode talking about types of bone injuries that correlate with disc, so you can pay attention, talk to your practitioners. If you like this episode, please hit the like button, share it. Please, let's get people involved. Let's get this education. If you want more information, like our free newsletter, more information, please go to drjeffgarofalo.com. Get signed up for the newsletter, and we'll send you out a free e-newsletter with tons of information nonstop. I'm Dr. Jeffrey Garofalo. This is Straight Back Talk. We appreciate you being here. We look forward to seeing you soon.